So in the previous video, we saw the summary of clinical features of hepatic failure. So for instance, we saw jaundice, fetor hepaticus, which is due to mercaptans, and GI bacteria on the sulfur-containing methionine. Palmar erythema, spider angioma because of estrogen metabolism. Hypogonadism, gynecomastia because there is too much estrogen. Peripheral edema because of low albumin. Cerebral dysfunction because of high ammonia. Hepatic encephalopathy, hepatorenal syndrome. Specifically, while talking about palmar erythema in chronic liver disease, there is sparring in the center of the palms, which is to be noted. Susceptibility to failure of multi-organ system. Respiratory failure with pneumonia and sepsis may combine with renal failure. Coagulopathy attributed to impaired hepatic synthesis of blood clotting factors such as 2, 7, 9, and 10. The resultant bleeding tendency leads to massive GI hemorrhage. A spider nevus consists of a central arteriole with radiating thin-walled vessels. So that is about the spider nevi. It's a central arteriole with a radiating thin-walled blood vessel. Terry's nails is a physical finding in which the fingernails and/or the toenails appear white in color with a characteristic ground glass appearance without any lunula. It is seen in chronic liver disease. First laboratory abnormality to occur in hepatic encephalopathies, raised PT, prothrombin time. In child with acute liver failure, the most important prognostic factor for death is increasing PT, prothrombin time. Symmetric high voltage triphasic slow wave pattern is seen on EEG in hepatic encephalopathy. Terry's nails are seen in liver failure. In transplantation medicine, the Millen criteria, MILAN, Milacunis, no, I'm kidding. Millen criteria are applied as a basis for selecting patients with cirrhosis and hepatocellular carcinoma for liver transplantation. So, Millen criteria state that a patient is selected for a liver transplant when he or she has one of the four things or all of the four things. Okay, I'm not sure. But like four things are there: no extra hepatic manifestation, no vascular invasion, one lesion smaller than 5 centimeter, up to three lesions smaller than 3 centimeter. Okay, no vascular invasion, no extra hepatic manifestation, one lesion smaller than 5 centimeter, up to three lesions smaller than 3 centimeter. Okay. Moving on to the MELD. MELD stands for Model for End-Stage Liver Disease. It is based on INR, serum bilirubin, serum creatinine. INR, bilirubin, creatinine is MELD. In interpreting the MELD score in hospitalized patients, the 3-month mortality is calculated. If the score is 40, there is a 71.3% mortality. 30 to 39 score is a 52.6% mortality. Okay, just remember the numbers, okay? 40 or, okay, the score is less than 9, 10 to 19, 20 to 29, 30 to 39, more than 40. Okay, so if it's less than 9, there's a 2% mortality. And if it's 10 to 19, it's a 6% mortality. 20 to 29 is a 20% mortality. And then it's a 50% mortality. And then it's a 70% mortality. 2%, 6%, 20%, 50%, and 70%. 2, 2, 6, 20, 50, and 70. Okay, in that order. MELD score greater than 14 is an indication of liver transplantation. So MELD score la vandu மூணு parameters இருக்கு. INR, creatinine, and bilirubin. INR, creatinine, bilirubin, the most important ones. Okay. INR, creatinine, bilirubin vandu MELD score. Child book score la vandu INR is there. Bilirubin is also there. But instead of creatinine, we have three other things: albumin, ascites, and neurological disorder. Okay, albumin, ascites, neurological disorder is for child pug. PTINR is for child pug, and bilirubin is also for child pug. Spider angioma is a common benign vascular lesion present in 10 to 15% of the healthy adults and young children. They appear as solitary or multiple lesions. It is characterized by a central red arteriole or a punctum representing the body of the spider, surrounded by a radial pattern of thin-walled capillaries resembling legs. While most lesions are unrelated to internal disease, spider angiomas have been associated with thyrotoxicosis and frequently occur in the presence of estrogen excess states like pregnancy or during the use of OCPs. Okay, which is why spider angioma is associated with estrogen. Okay. So, as a summary, we saw about like the multi-organ failure, coagulopathy and stuff. And then about the lunula and the Terry snails. And about liver transplant, we have the Millen criteria, the four criteria: no blood vessel. Okay, Millen, MELD, that's it.